Thanks for staying with us on The Real Story. In today's committee close-up, we are taking a closer look at the Human Services Committee and their legislative priorities for the 2023 session. So joining me right now, Senator Matt Lesser, co-chair of the committee, and ranking member Representative Jay Case. Thank you both so much for being here.
Great to be with you.
All right, so let's talk about some of the priorities there. We're talking about lowering drug costs for people, prescription drug costs, as well as support for intellectual and developmental disabilities. There's some of the things that we looked at and can tell that those are your all priorities, but what do you want to start with? I feel
those
like
happen to be two of the biggest bills that are out.
Okay,
so,
well there you go. We did our research correctly.
5001, which is the intellectual and developmental disabilities bill. I mean, I started this back in 2013, and now it's the speaker's main point that he wants to get across. And there's numbers are staggering between 1,000 to 2,000 people, depending on intellectual developmental disabilities and the autism waivers. So we want to deplete those waivers and get people out there and get people into housing and get them where they need to be.
Explain what that is to people. There's a wait list for services, right, for people who have intellectual and developmental disabilities, and talk to me about.
So you sign up for services, and
Okay.
we only have so many places of housing out there in the state of Connecticut. So what we're trying to do is work with the department, DDS, and after we started working with DDS, we're finding out that there's other pockets, DCF, Department of Corrections, they all have wait lists for IDD also. So we're trying to pull all that together and finding out throughout the state of Connecticut where these different pockets are, where these people live, where the geographical areas. Then we have to look at their level of need, Alon, to see where we can place them, who we can place them with, so, and where we have employees. But our biggest thing this year, and I think Senator Lesser will agree, is workforce development. We need to get workers back into the fields, back into the nursing fields, the CNA fields, into the catchment area of the most vulnerable people, because if we can't get the workforce going again, it's going to be very difficult for us to put a lot of the things forward that we want to.
Yeah, I know we talked about that with the Public Health Committee folks. And, you were saying the autism lifespan waiver list is like, it's sad to see that we have some 2,000 people on this wait list, and only 219 people are receiving services right now. That's heartbreaking when I see that.
It's heartbreaking to see families waiting for the care that they need. And Jay's right, it's a workforce issue more than anything else. We just need to make sure that we have the workers on hand to provide the services that people need.
So is it about, I'm sorry, I didn't mean to interrupt you, is it about incentivizing people into the industry, right? An industry that's burnt out right now.
It is, but we're also, we heard on Tuesday from a woman who'd been working at a DDS group home for 19 years and was making $17 an hour, and this is back-breaking hard work. It's a lot to ask of folks, and if you could be making the same amount working at a Walmart or a Target, it's not hard to understand why we're really struggling to attract workers in this field, and we've got to make sure that we're paying people appropriately, that we're providing them with benefits. We need to make sure that we have the workers necessary to take care of this incredibly important population.
If you look at it too, in the healthcare agency, we're about 50% less of employees since pre-pandemic. So in these fields of CNAs, PCAs, we really need to educate. And we had a big downfall with Stone Academy,
Yes.
closing down. So, and that was our biggest feed into this industry. So we need to work on higher ed, which I also serve on, and try to get that workforce development together so that we can get there. This is our most vulnerable population, and we need to be the voice for those who don't have a voice. And that's what I want to do, and I think that's what Human Services does, and we try to do it together. My brother was in a group home. So it's very near and dear to me. I grew up with him. I understand it. I get it. So that's why it's very passionate. But there's families that are in their 70s where their sons and daughters are still living at home. They need to live their golden years. We need to get them into some place where the family feels comfortable. And that's what we're trying to do.
If your family lived this, what are some of the challenges that families face?
Some of the challenges that we face is we have to find the right housing in the geographic areas where they live, because you don't want to be that far away from your family member. We do have housing, so we do have beds, but we don't have staff for the beds. And that's what we're trying to dig down to, and we're trying to figure out if we need to build more areas. We need to build some more facilities. There's some great places out at Favar and Canton. There's a new one in Bloomfield. So we have some momentum going. I think the speaker just wants to keep going on that momentum, and let's get people where they need to be.
Do we know a cost that it would that it would cost to get people off of this wait list? Or, I mean, it's interesting you're saying it's a workforce shortage, right? So that's a bigger problem than just this is the amount of money that we can throw at it and help the wait list go down.
And that's right. So it's not just a budget. It's a whole systems issue. But we need to make sure this is what government's supposed to be there for, is to take care, to make sure that we have a safety net in the state for the most vulnerable. And right now we're not meeting the challenge. We're not meeting the need. So it's more than yes, it's a lot of money, but it's more than the money. It's making sure that we're not just throwing money at an issue, that we actually have a system there to support folks.
But just think about it. When you talk about the money, we really don't want to, as Senator Lesser just said, it's not always about the money. It's about getting the people there. But just think about it. The workforce development, getting people jobs, getting people out there to build these facilities. We're creating industry along with a place for people to live. And it makes them more vibrant. It gets them out into the working field. There's so many things with this that we're learning. We were on the Department of Housing yesterday. They have money. They have bonding money available to go out and build these facilities. So we are really, that's knocking down on the costs on the of the running of the facilities, because we're going to deplete, we don't have to use as much money in order to build them out. But let's do what's right. Let's get these kids and adults out to where they need to be. It's amazing how many are in our school districts that we don't know, that we have to work on their aging out process.
Right, that's
so that
very
when they
true.
graduate from school at age 22, they have a place to go.
Yeah, very, very true, and very important issue. Let's also make sure that we cover prescription affordability and healthcare coverage, because that's another big thing that the committee is looking at. Let's start with, prescription drug costs. I have a statistic here. Last year, the Kaiser Foundation did a survey, and that it concluded that nearly 13 million Americans were skipping or delaying taking their medications they need because of the cost. Another heartbreaking statistic that we're talking about here. What's Connecticut doing?
Well, first of all, we're sick and tired of paying the highest prescription drug costs in the world. It is outrageous that, we get the same drugs that folks in Canada, folks in France and the UK get, but we pay more, and we are subsidizing their prescription drugs. And that's not fair. That's not fair to seniors, to families in Connecticut. For the first time, though, Congress has taken action and said Medicare can now negotiate down the price of prescription drugs. It used to be they were prohibited from negotiating prescription drug prices. And we're saying, look, if that's good enough for Medicaid recipients, and it is, we should take steps to make sure that those savings can be accessed by everyone in Connecticut. If you have private insurance, if you're on Medicaid, if you're anybody in Connecticut who needs prescription drugs, we should be able to negotiate the price of prescription drugs down. And we're hoping to do that, set that Medicare rate as the standard. And then we can also do things like bulk purchasing with our sister states to see, well, what can we do to bring down the cost of drugs? This is the single biggest driver of healthcare costs in this country. And look, we're seeing higher prices for an awful lot of things, for eggs and milk and groceries, but it didn't take the pandemic to start to see this massive inflation in prescription drug costs. It's been going on for way too long. And this is one of the ways that the state could provide real pocketbook relief to the residents of the state this year.
But I really see that, looking at this, and yes, it is a big issue in the state of Connecticut, but being on Human Services, we are the money company the money committee that puts the money forward to help pay for this.
Sure.
The insurance committee really needs to deal with and work with defraying the costs and see what they can do with the insurance companies. We don't have the negotiation power to do that. We have the power to be able to find out what we can get reimbursed on the federal level, to what we can disperse, at a reasonable cost to people. I mean, that is the biggest thing. And that was one of the biggest things, I have to tell you, with the IDD and having to go back to my brother was, he went into the group home with Title 19, because his insurance or his medication cost was over $5,000 a month.
Wow.
Jen, I think this is just too. I mean, I don't mean to cut you off. I just want to say that the prescription drug costs are too important to say that this is one committee's job or another committee's job. This is the legislature's job, and the insurance committee is holding a hearing. We're holding a hearing, but we got to move forward. We have an opportunity to move to really capitalize on the recent action the federal government has taken. There's no reason why Connecticut should wait behind other states to provide real prescription drug relief.
Have you talked to the other committee members about
I'm on
collaborating?
all the committees. I'm on the insurance committee too, and they're
So you feel like
they're
there's
taking action too.
collaboration?
Yeah, absolutely.
And do you think something's going to happen this session?
I think so.
Okay. Talk to me. We only have about a minute left, but talk to me about the Array RX consortium. Is that what you're talking about with the pairing with the other states to negotiate it down, or is it different?
Exactly, yeah. It's bulk purchasing. What can we do to provide real relief to the resident?
Okay, all right. Anything else you guys want to highlight that's a priority for the
I
committee?
happen to agree with that. Consortium stuff is great throughout the country, because if we can work with other states, businesses work with other businesses. The COGS, municipalities work with other municipalities. That's what we need to come down to and work together. We need to get stuff done.
Well, you guys have worked on a bunch of stuff together, so it's definitely a lot of bipartisan action on your committee, it seems like, which is good.
So
We gotta keep it that way.
Yeah.
Okay, we like that collaboration. Did you have something you wanted to say, Senator Lesser?
No, I was just going to say there are a few other things in the hopper. We're trying to make sure that we're paying doctors fairly. We're raising Medicaid rates and just expanding access to coverage. There's so many people who've fallen through the cracks in the middle class the last few years, who make too much money for Medicaid, but not enough to afford their private health insurance. We're just trying to make things easier for those folks in the middle.
Last word for you?
All said, Jen, we got to get people back to work and get our most vulnerable people places to live.
All right, Representative Jay Case, as well as Senator Matt Lesser, thank you both so much for coming on The Real Story and talking about the work that you are doing this session. Appreciate it.
Great, thank you.
Thank you.
All right, that does it for us on The Real Story. If you want to watch these segments again, head to fox61.com or download the Fox 61 app, and you can watch The Real Story every Sunday at 10 a.m. right here on Fox 61 or streaming on Fox 61 Plus. Have a great morning.